Hello, my name is Raimundo Lugo, and I'm a registered nurse working in the intensive care unit. The title of my project is Optimizing Pressure Injury Identification in Critical Care. So, the problem I identified on my practicum side is the failure to identify pressure injuries on hospital admission and misclassification of pressure injuries. My preceptor and I identified several different problems in the ICU, and we came to a conclusion that pressure injury classification would be a good topic to focus on, and it would have a good impact on the outcomes of our patients. The failure to identify or misclassify pressure injuries lead to improper treatment, delayed treatment, or wounds that result in hospital acquired pressure injuries. My preceptor and ICU manager um, helped me analyze this nursing problem, and our findings clearly demonstrated that evidence based education and reference tools improve nurses' accuracy in identifying and classifying pressure injuries, enhancing documentation and patient safety in critical care. The unit manager, clinical nurse coordinator, and wound care specialist collaborated by assisting with workshop scheduling, providing expert feedback on the reference manual, and ensuring staff participation. Their teamwork supported smooth planning, effective implementation, and meaningful evaluation of the project outcomes. My clinical nurse coordinator, which was my preceptor, served with guiding project planning, coordinating in-service sessions, maintaining communication, engaging stakeholders, and offering continuous feedback to ensure successful project completion. The target population consisted of 75 critical care nurses who provide direct care to high risk patients and are responsible for identifying and documenting pressure injuries, with only 47 participating in the education sessions and surveys. I wasn't able to contact with everybody. Throughout my project, I created an in service training and a reference manual to improve ICU nurses' knowledge and confidence in accurately identifying and classifying pressure injuries. This included a pre-intervention survey, followed by a workshop, which I did in different shifts, so I can be able to reach more nurses. A manual that can be used in the ICU, which I left at the nurses station, and a post intervention survey at the end for evaluation. My project was implemented over 6 weeks through multiple in-service workshops using both printed and digital copies of the manual for easy accessibility. The post-intervention surveys showed increased nurse confidence and knowledge. High, this indicated a successful achievement of my short-term goal, since there were higher number of nurses who feel more proficient or experts in identifying pressure injuries overall. My pre-intervention results showed that 22% of the nurses rated themselves as proficient or expert, and at the end of my project, my post-intervention findings showed 70% of the nurses rating themselves as proficient or expert, showing an increase in the numbers. As a long-term impact, achieving consistent and accurate classification can improve care quality across other hospital units and patient populations through standardized education and reference tools. In regards to project limitations, I faced some challenges such as scheduling, um, limited participation across the units, and a short evaluation period. It was difficult to reach all the nurses due to the busy schedules, different, but I was able to reach a substantial amount of nurses throughout my project. To expand the implementation, my project could include flexible online training options, objective assessments, and adaptations of the manual for different units or patient care settings. This was my presentation on improving pressure injury identification and how my reference manual helped nurses by improving their knowledge on this subject. Thank you for your time.